Our next speaker for the afternoon is Mr. Freddy Jacquin. He's one of the leading figures in the field of clinical hypnosis. He is the founder of the Jacquin Hypnosis Academy and has literally trained thousands of hypnotherapists, not just through his own training academy, but also by sharing his insights with the College of Medicine on our, what's it called, Freddy Free Friday?
Free Friday therapy at 4.
Afternoon. He's going to be talking to us about how hypnosis works synergistically with other conventional and complementary therapies to improve overall health outcomes, such as managing pain, reducing stress and anxiety, improving sleep, and addressing a range of chronic conditions. Over to you, Freddy.
Hi, thanks, David. Well, thanks everyone for being here. I'm a hypnotherapist. But let me start by saying I'm not going to talk about hypnotherapy because for a lot of you medical doctors, if you were to start talking about hypnotherapy to your patients, you'd probably lose credibility. So I'm going to talk about what I know helps people, and I only have words. So unlike the panelists who have abilities in alternative, the medicines and chiropractor, I don't have any of those skills. All I have is my words. But how can we help people change? How can we help people out of chronic pain in minutes with just our words? Without mentioning the word hypnosis, without saying I'm going to take you into a trance or anything like that. How could that possibly be? Over the next 20 minutes, I'm going to explain what I believe is how this works. And to be honest with you, it's very simple. If I or you can create an emotion, you can give a suggestion that bypasses any critical resistance. It's the way we work as human beings. If you think about how we go through our life, we're being influenced all the time by marketing, by other people, but generally it's with emotion. If I can make you smile, I can influence you. If I make you sad, I can influence you. And that's how this works. The question is, if you could help your patients out of pain in your 5-minute or 10-minute GP appointment, would you do that? That's the question. And there are times when I'm sure when you're giving your patient maximum pain relief and it's not healthy to give them any more. In those instances, what I'd like to think is that you better use your words in that 5 minutes to help them. It's not another technique. I'm not going to show you another technique. I'm known for what's known as the arrow technique. It's gone all around the world for chronic pain. But what I've realised by working with hypnosis, it's not about the techniques. There are a million techniques out there for pain control. There are a million techniques for overcoming habitual behaviour with a million different people. So what is it that actually works? If it's not the technique, what is it? And I think it's an understanding. It's a knowing. And I'm going to share with you in the next few minutes what I believe that understanding is. So not just with your patients, not just with your clients, but for yourself. To understand that if you are suffering in some way, and the pain we're talking about here is what I call chronic pain. Pain that's outlived its purpose. We know that pain has a purpose initially, to draw our attention to something that needs medical attention maybe. But once that's been done, then there's really no need for that pain. And I've had people fly to different events that I've done to ask me the question, how could hypnosis possibly help someone who's in chronic pain? And it's a big question, isn't it? We're not giving them any pills or potions, so how can that possibly work? And my answer, and it's only what I call a Freddy theory, don't charge me on this, but I believe it's this. We all know that if our life is under immediate threat, we have the ability to switch pain off. We've seen this in battle situations where people have horrendous injuries, carry on fighting. So I believe that we all have that ability in the right circumstance, in the right state of mind, to switch off pain that's no longer of any use for us. So I'm going to ask you the question in the room. How many people in this room, I'm not going to bring anyone up here, so how many people in the room are suffering some kind of pain or discomfort, whether it's physical or emotional? Please put your hands up. Quickly have a look around the room and you'll see this. If you imagine this is the world, you'll see how many people in general are suffering from some kind of pain, emotional or physical. In a moment, in a few minutes, you will not be able to feel that pain. And I'm not going to give you any pills or potions, okay? But that's my intention, that's my expectation. So I'd like all of you to just put your hands up. So symptom scale it, on a scale of 1 to 10. 10 being excruciating, 0 being no pain at all. Don't have to shout it out, just in your own mind, how bad is that pain right now? Okay, because in a while, you won't be able to feel it. So, I'm going to start by telling you a story. It's a true story. In the northeast of England, there lives a man, and if you were sitting next to him on a bus or the train, you probably wouldn't give him a second glance. He's nothing special about the way he looks, and you wouldn't realise you're sitting next to a genius, an artist. Because that man, his name's Mr. Ramesh, and he's a heart surgeon. And every day of his working life, he saves people's lives and he enhances people's lives. And 8 weeks ago, I was lucky enough to have him as my surgeon. And he carried out what my wife lovingly calls a cabbage, a coronary artery bypass graft. So he took a vein from my leg and he repaired my heart. And not only that, but he took my aortic valve, my 73-year-old aortic valve, and replaced it with a new one. And as you can see, it was successful. So, and if any of you know what that operation's about, they saw through your sternum and they pull your ribs apart. Then they stop your heart, repair your heart, and repair the valve, and then put you all that together, wire it back up. And that's what happened to me a few weeks ago. But in ICU, I can tell you the pain's pretty bad. And you want to cough because they've deflated your lungs. And coughing is the last thing you want to do, because if you've ever had a broken rib and you cough, you know what the pain's like. To have your sternum split open and rewired, it's like a dagger in your chest every time. But in ICU, I had, over 5 days, I had 5, I can't call them nurses, they're like angels. And the kindness and the love they give is immense. It's beyond kindness. There was Ruby, Anya, Katie, Inez, Joanna and Mary, and all of them were phenomenal. And I'm a pretty optimistic person. Naveed, Michael, they know me. I'm an optimistic person. I generally look on the bright side. But the pain and the medication, I've never experienced anything like it. And I went to a place of dark despair. I've never been there before. I was willing the devil to take me at one point. It was a terrible place. Luckily, on that evening, Nurse Inez was on duty. Now, she's one of those nurses, you probably might be one yourself, very efficient, very organised, very knowledgeable and incredible. She's the kind of nurse that the consultants consult. And she was on duty, and her sixth sense told her that I was in a bad place. So, when I think about this, I feel like she knelt by my bed, but I don't believe she did. She's probably standing there. Now, this is nurses originally from Madrid, a brilliant, brilliant woman. And she could see where I was in this state of despair. And she put her hand on my arm, and she said, "Freddie, look how far you've come." She said, "You're a survivor. And this too will pass. And now you can forget about the pain. And you can let go of the useless, unnecessary anxiety." In that moment, my life quite literally changed. And the pain went. And the anxiety went. This is a true story. And I want all of you to think about this now. All of you who put your hands up earlier, as you listen to this story about Inez, I want you to notice your pain's gone. I want you to try and feel it and find you cannot. On a scale of 1 to 10 now, where's that pain gone? Try and feel it. And if your pain's gone or been drastically reduced, I'd like you to stand up so that I understand. All of you who were in pain earlier, if your pain's gone or been drastically reduced, stand up for me, please. Where is there any hypnosis in this? Please sit down. Thank you very much. Where's the hypnosis in this? If we can create an emotion, this is a true story, I'm not making this stuff up. I still think about that hand on my arm. And if I suffer any kind of pain, and I think about that woman's hand on my arm, and I think about her words, I can alleviate that pain. And all of you who've just stood up will be able to do the same. I promise you, from this day forward, if the pain you're experiencing is useless and unnecessary, and you want freedom from it, think about what I've just said to you. Think about Nurse Inez. Some of you probably felt a hand on your arm when I explained it. And you can go back to that point any time in your life and alleviate your pain from today. So what I'm saying here is this. I didn't give you any pills or potions. There's nothing magical about me. Now that you're free of that pain, you have to understand you were always able to do it. You just didn't understand that you could. And this is the understanding I want you to get in these few minutes. What if you could, and I believe you could, if you had a patient that is in terrible pain and you can't give them any more medication? What if you were to tell them this story, which is a true story? You could say, I saw this guy, he was talking about this operation he had. If you were to just tell that story to someone, the chances are, if you did it with the intention of helping those people out of pain, the chances are that you would alleviate that pain. Do we understand this? What you have as medical professionals is authority. We are born hardwired to follow the one least uncertain. Now, in general, that's our mother, because she's there, and we don't know right from wrong, we don't know what's truth or lie, and if our mother says this is the right thing to do, the chances are we're going to follow that. We're hardwired to do that for our survival. But that doesn't go away. That hardwired to follow the one least uncertain. In your practice, you are the authority. You are the one least uncertain. And what you say is super effective. Naveed and I ran, a couple of years ago now, we ran some talks on the power of language, didn't we? You're the one least uncertain. So what you say goes. When Mr. Ramesh said to me, Freddy, look, we're going to do this operation. And he said, this is what we're going to do. We're going to cut your chest open, saw it open, pull your ribs apart, stop your heart, stop your lungs. I went, okay. Now, where else would you do that? If someone walked up in the street, in a moment, I'm going to cut your chest open, pull your heart out, you're mad. But just because he didn't show any doubt in his voice. He said, this is what's going to happen, and this is how you're going to feel, and it's going to give you 25 years at least. And I just went, yeah. And there was no doubt in my mind, there was no fear, no anxiety about that at all. It was madness, really. But because he was completely sure of what was going to happen. And this is the position you have. You have to act as if there's no doubt in your mind. If you do this, the chances are you're going to feel better. I want you to understand the importance of your language beyond, as Professor Michael Dixon says, beyond pills and potions, beyond the techniques and the protocols. What is it that really matters? It's you. It's you. It's your attitude. It's your expectation. When I started this today, I expected those people to be free. I expect you to be free of the pain. My intention was that you're going to be free of that pain. I'm willing to share something that was pretty meaningful to me to help you understand that. And you did. You know, that's how powerful our mind is. If you just get someone thinking about their children. You know, I see people for drug problems. They come and see me, heroin addicts, cocaine addicts, people who smoke. I've seen 25,000 people help them quit smoking in my time. And those people, generally, it's an hour, and they go out and they don't have a cigarette again. And I ask the question, it's a simple question sometimes, because they say, you know, it helps me relax. It helps me this, it helps me that. I say, would you want your child doing it? They go, no. Well, think about your child. Understand the importance of your child. How many of you in here have got kids? Well, not just kids. I want you to do this, all of you. Just do this for me. I want you to think about the people you love most, or the person you love most. It might be your pet, but think about that person, think about those people, and just for a moment, see those faces and feel that love. And really feel into it. Get a sense of that love right now. And as you feel that love, I want you to notice that you're stuck in your chair and you can't stand up. And when you realise you're stuck in your chair and you can't stand up, I want you to try and stand up and find you cannot. And I don't want you to pretend. Try and get out your chairs, see what happens. Try and stand up, find you're stuck. Why can't you get out your chairs? Try and stand up, put some effort in. Come on, you're strong people. I know, it's really weird, isn't it? Really strange, right. But where's the hypnosis here? And I just asked you, I asked you to think about the people you love, and I suggested you were stuck in your chair. That's no different than being stuck in any other form in our life. Stuck with a belief that no longer serves you. Stuck with a fear or anxiety that no longer serves you. It's no different. Every one of those irrational fears, every ounce of chronic pain that no longer serves you was suggested, whether self-suggested or suggested by someone else. And if it's been suggested, and we understand this, you can unsuggest it. I want you to think about this. If every limitation in your life, if every limiting belief you have was suggested to you, because you didn't come into the world with those beliefs, they were suggested or self-suggested, then you can decide to imagine that differently, can't you? What if that was just the case? Every limiting belief you have that's holding you back, you could say, well, I'll imagine it differently. Because if you think about anxiety, we were talking about anxiety with the panel earlier, and pretty much every one of those case studies had anxiety somewhere in it. IBS, the guy with the back pain who's lost, his relationship. There's a level of anxiety in that. But I want you to understand is this. If you're anxious, you are thinking about a future situation. You're imagining an outcome, aren't you? Because in this moment, it's not happening, is it? It's only your imagination. There is only this moment. The past, which most of us are living in, no longer exists. It's a vacuum, it's a void that stretches back to the Big Bang. It's done. And even if you could change, if whatever happened in the past, there's nothing you can do about it. If I just said the most stupid thing, I can't get it back because it's in that void. And the future hasn't happened. It can only be imagined. So if you're suffering from anxiety, you are imagining a future outcome. You have to bring yourself back to the moment and remind yourself that in this moment, it's just my imagination. You are going to imagine something. You can't not. That's the way our brain works. It's called a schema. When you understand that, you can say, well, I choose to imagine it differently. You don't have to live with pain anymore. Think about Nurse Inez. Think about her hand on your arm. Think about her words. You can forget about that pain. You can let go of the useless, unnecessary anxiety and stress. In that moment, you feel into it, and that pain will be gone. Providing that pain is useless and unnecessary. I'm not asking you if you've had stomachache for 2 weeks to just try and alleviate. Go and see your doctor. But if the doctor says this is just chronic and all I can give you is painkillers, that's the time when you can use your mind to overcome those pains. Are there any questions? I think we might be running out of time. Any questions before we... does everyone get this? Because I want you to use it. I want you when you're speaking to your client or you're speaking to your patient to understand how important your words are. And if you can create an emotion, and the thing is, when a patient's in the doctor's room, they're not in the same state of mind as they are when they're buying their groceries. If they're in a dentist chair, you're not in the same state of mind as you are when you're buying your groceries. You're in an altered state. You don't have to induce a changed state. They're already in an altered state. Understanding that and understanding your words are super important, you wait for a moment. Ask the question. And if you see an emotion rise in that person, be ready with a suggestion. For me, it's a simple suggestion. You're going to get over this. This too will pass. You're going to feel better. You'll recover. If it doesn't sound like a hypnotic suggestion, but if that person has just experienced an emotion, that's going to drop in as a suggestion. And the chances are their body is going to react to it. Just as your body reacted when I asked you to get out of your chair. So I want you to use this. Start with using it for yourself. Think about, when did I learn this fear? Was it suggested to me? And I can just unsuggest that. I can suggest something else. I can believe something else. We can change our lives. We don't have to live with decisions we made when we were kids. We don't have to live with irrational fear or pain that no longer serves us. And we don't have to have any extra pills or potions to do it. You already have everything you need in your mind once you understand this. I don't know how much time we've got in the video. Time? All right, thanks for listening to me. And I hope you enjoyed it. Thanks very much. Thank you.
Thank you very much, Freddy, for those powerful words.